just go ahead and give me a clap, and then you can ask the question. Perfect.
Good.
Love it.
Loud clap. Yeah. Nice. Okay. Cool.
All right.
50, almost 57. Next October 4th, I'll be 57 years old. I'm the senior manager for a construction company. I live an active lifestyle. I race sailboats. I cycle. I play a lot of golf. And I'm a first tee volunteer coach, and I work with children ages 7 to about 15.
Tell me about what were the steps that kind of led you to possibly look at seeing a doctor, or kind of walk us through that process.
Well, my body forced me to. Like, I couldn't play golf anymore.
Wow.
And when I can't do that, then that's a problem. So I stopped to get some help, and a friend of mine referred me to Plano Orthopedic and Sports Medicine Clinic, and I was lucky enough to find Adam Wright, who did my surgery. Fantastic human being, and his whole team, his PA, David, and everybody there that supports. It's just a fantastic place, and I can't speak highly enough of them. And when you find the right doctor, all the dominoes fall, right? When you feel comfortable, when you trust that person, it changes that concern and that mystery before surgery. And when you can let yourself go, when you can let your mind and your heart go, and trust in the process, no matter what you're doing in life, it's a great thing. And Adam was fantastic. Right off the bat, he pulled a chair up. I mean, his face was this close to me, and pulled a chair up. What can we help you with? And he was that way, and his entire staff, they were that way all the way through the process. Awesome. It was serendipitous finding him, and I couldn't have gotten luckier. He instilled trust so quickly, and everybody there listened to me throughout the process intently, and it just, honestly, I started through the process because of that. It started with the trust and letting all that concern and worry go away.
What would you feel like the goal of this conversation? What do you want to give to patients in terms of this kind of experience? What do you want to take away as well?
Well, unfortunately, I have a lot of experience with orthopedic surgeons because of my life. I've done a lot of different things that required orthopedic care. This was I had a full hip replacement on the left side, anterior, so they went through the front of the thigh. What I want people to learn from me is the steps before, during, and after surgery that I took to get through the process as quickly as possible. And hopefully by watching this video that people can learn. I already had one hip replacement, so I understood what was going to happen. I want people to learn to get that same mindset before, during, and after. The things you can do in preparation while you're recovering quickly after surgery, and then as you start to move and function normally again, how to continue to preserve that area, following the directions and moving through the process as quickly as possible. I felt 90% at 3.5 weeks. I feel 95 to 100%. I'm golfing. I've been golfing the last 3 weekends, and there's no pain, which is a lovely result of surgery. I'm a little sore still. The next morning I wake up, oh yeah, you're 57 and you just had your hip replaced. So pre-surgery, the best advice I can give future patients is to quantify the pain level. Docs will ask you, what's your pain level 1 to 10? Obviously, if you're at the point where you need a full replacement or a knee replacement or something like that, the pain's going to be up there 9, 10. And to quantify that and remember that, make it indelible to the specific preparations, there's a couple of things. So the doctors and the team at the Legion Surgical Center, where I had my surgery, they go through very specific instructions. They give you equipment. They give you a device that circulates cold water through a pad that'll be on you for about 2 weeks after surgery. They're going to talk to you about how the brace functions, all of that type of stuff. And you need to experiment with that. You need to put it all on, how to take it on and off, what's comfortable, what's not, doesn't need to be shifted in its, in its location, because you're going to be in bed and stationary. You don't want anything pinching or to be uncomfortable. So make sure you understand how it all works. I was by myself quite a bit. I had a lot of friends coming over, but I was by myself quite a bit. And I needed to make sure that from my bed I could do everything that I needed to do. So I went through that process of literally pretending like I was post-surgery. How does all this work? Is it in a convenient location for me? The best advice, and I'll talk to you about this pre-surgery, is to buy the small 8-ounce bottles, the stubby water bottles, and freeze that, a whole case in your freezer. Because your ice machine in the refrigerator will not recycle fast enough, and you need to have ice. It's one of the most important things. The night before surgery, you shower, and you wipe yourself down with disinfectant pads. It's important to follow directions. There are areas where you should not get that material close to, but other areas surrounding that, you should really clean yourself well with that. It's also important to have fresh bed linens to come home to, because post-surgery, what we're trying to do is keep infection down, and that'll speed the process of healing and everything. So I did all that. Fresh bed clothes, took a shower, wiped down with the disinfectant pads, went to sleep. You wake up the next morning, you do not shower, but you use the pads again before you go to the surgical site. So if you do that in preparation before you go, and I ended up getting to the hospital. I had a ride from a friend, and I had to go a little earlier than they wanted me to be there, and they took me right away, and everything went smoothly. The other thing is, stop drinking alcohol, stop eating sweets about 2 weeks prior to surgery. I feel that that's a really good thing to do, and to get that stuff out of your body. The doctor asked to have protein supplements to consume, so Ensure has a pre-surgery and post-surgery drink that you can buy, and you can get it online. There are other brands you can use that work just as well. We're looking to have more protein in your body, because that's going to help you to heal it. You get very specific instructions before surgery, and if you follow those instructions and get yourself teed up, ready for when you get home from surgery, then you'll be in good shape. I got to go home. My surgery started at 9:15, and I was home that same day in my own bed at about 6:15.
Okay, Dr. Wright performs the surgery, and you're in bed. What's the first thing you remember? If you could kind of walk us through that process in the hospital.
I'm starving. I need food. That was it. Because you're not allowed to eat anything, food or beverage. Except for one drink that you're supposed to drink before you go to the surgical center. So I was starving. I'm Italian. I love to eat. So I was hungry. So I was in the room, and they were getting me all ready for surgery. They gave me the anesthesia that knocked me out, and the next thing I knew, it's like, it's all done. You're great. And off to the room you go. You feel great. You're a tiny bit groggy, but they give you a spinal anesthesia that handles most of the pain, and a light anesthesia to put you under during surgery. And you come out of that really quickly, and you're starving. You want to eat. And then you're up and you're walking down the hall on a walker. I was walking at 2 o'clock. It's just crazy. Yeah. Walking down the hall with a walker, with the other patients that Dr. Wright had performed surgery on, and we're like, Adam Wright? Yeah. You look good, man, so do you. And it was wonderful, and different age people. I was the youngest because of my behavior. But there was a gentleman that was 15, 20 years older than me, doing just fantastic. Wonderful. And it's just great to see other people are getting relief too. It hurts. Yeah. It hurts a lot. And every movement that you make, it's part of the core of your body. Every movement that you make, when it gets to the point where it's unbearable, it's really difficult.
You're now after surgery. You're getting home. You said around 6 o'clock, right? Walk us through what your experience is, and just kind of how that went, how that process went.
It was an easy process, again, because I prepared. I figured out all this the devices, and everything was set up and ready for when I got home. So the preparation took any sort of concern away from coming home and what's it going to be like. I'd gone to the grocery, everything was stocked, everything was ready, tons of water, all the things that I was supposed to do. And you do get explicit instructions from your doctor, from the surgical center, and from your organization in terms of what to be ready for and how we're going to move forward. The first 3 days were, pretty easy, frankly. I live by myself. My bedroom and everything is upstairs. My kitchen and everything, living space is downstairs. So I was up and down the steps. And the first 3 days, I had the nerve block still working. You're on pain medication. Everything's fine. But after that third day, moving into the fourth day, the nerve block wears off. Things start to be real. And it's very important to not push yourself too far. Always use your walker. Always use your crutches. Whatever you can to take the weight off. You're going to feel great for 3 days like you're Superman. And then the nerve block wears off. And that's when the pain for the anterior hip replacement that I had, so they went through the front of the thigh and pulled the muscles and all the connective tissue out of the way. And so at the very top, basically where your hip bone is, at the top of that area where that soft tissue connects to your skeletal system, that's the primary source of pain for most folks that have the anterior surgery. And I was no different. In fact, it was really intense. And so I had a couple of really difficult days because I was trying to take the medication as prescribed. Through your organization, I was able to get in touch with Adam Wright, Dr. Adam Wright's PA, physician's assistant. He called me on a Sunday, said, just take more pain meds. Okay, just stay ahead of it and do the best you can to stay ahead of that pain because you're basically in the eye of the storm right now. So I followed that direction and got through that pain, and then it started to dissipate. And that was really the switch for me that it's really time to begin, pushing forward. As the pain alleviated, I got off the pain medication, and every day I tried to get 5% more mobility using the stretches that the physical therapist from your organization asked me to do. Nurses were coming through and checking the incision site, and everything was great. But you've got to push yourself a little bit, within the parameters set forth by your doctor and by the PT people. But you still have to push. The more you get some stretching, the more you move around instead of just laying in bed, the faster that pain goes away, the faster you get back to some mobility, the faster you get that brace off, the faster you don't have to walk on that walker or those crutches again. And that's the key.
So tell me about your experience with Charlin Health Services and home health coming into the home now that you had surgery. Kind of walk us through that process.
Again, it's an issue of trust and letting go. Yes, you're going to have strangers coming into your home, but why are they there? They're there to help you. A lot of you will have family members there. I was by myself. So it was really a question of these people are here to help me, and I'm going to welcome them into the house and let them help me. My first visit was with a nurse. They wanted to see how everything was proceeding. Every day they're taking vitals from you, so they want O2 saturation readings, they want pulse rate, blood pressure, all of those things, and they're making sure post-surgery that everything's going smoothly. The people that came to my house were fantastic, happy, caring people. We're in the middle of COVID right now, and it ebbs and flows. It looks like we're back into some pretty high concern. They wore their masks. They used hand sanitizer. Everything was disinfected. You can tell that the augmented concern over COVID was there. It was wonderful to have these lovely people coming into my house to help me and take care of me, both on the nursing side and the physical therapy side. And they listened and they helped me. My physical therapist put my garbage out for me. before he left, helping me recycle the ice in the water bottle, frozen water bottles that I use for my icing machine. Just so helpful in getting all of that done for me. Physical therapist comes within just a couple of days following surgery. I think it was day 2 after. I had a nursing visit on day 1 after. The therapist gave me a sheet of instructions, exercises to start performing when you're ready to do so. And he had me perform, they're broken into phase 1 and phase 2. Phase 1 is pretty delicate, shortly after surgery. Phase 2 is when you're ready to start pushing flexibility and mobility, all of those things. But phase 1 is really for that first week and maybe a little longer, depending on how you feel. So you get a very explicit list of exercises to do, and it's very important to start doing those things. Again, within the parameters set forth, don't push yourself too far. If you're uncomfortable, you don't have to complete them, but you need to try, even if it hurts a little bit. You need to try. If you're getting really uncomfortable, it's time to back down. And then have that conversation with your therapist. I tried to do X, Y, or Z, and it was really bothering me. Take the conversation from there and the advice from there from your therapist. As you move into phase 2, and you start doing a little more work, etc., that's when the progress really begins and you start feeling normal again. Again, I can't stress how important it is. Before surgery, quantify where your pain is. And after surgery, yes, you can have some pain at the top of your leg for a while, particularly that day 4, 5, 6 after surgery. But then that pain starts to dissipate. And I started backing off on my pain meds to see how I would feel. And I was off all pain medications. So we're talking about pain meds and muscle relaxers, the things that really make you loopy, that interfere with your digestive system and make you dizzy. So it makes you uncomfortable walking, moving around. So surgery was June 29th, and my last pain medications were Saturday night, July the 10th. And that was when my recovery really started. And when the phase 2 exercises were incorporated into my daily life, several times a day. I have a stationary bicycle. I have a set of rollers for my street bicycle, and I was riding those rollers. It's a very linear motion. The doctor doesn't want you moving the leg, the knee, toward the inside of your body or toward the outside too far. But the bicycling was very linear. And that allowed me to move, get my heart rate up, get blood moving through my body, because that's what takes oxygen and nutrients to the surgical site. That was that moment. Moving, getting off the pain meds, moving into phase 2 under supervision by the therapist that you guys sent to my house, and on my own, beginning to get back into moving and back to being normal again.
Kind of walk us through a little bit of the therapy side in terms of some of the things that our therapist did to kind of help you with that pain process.
So 2 things here. I wanted to get off the pain meds, but there's still some discomfort. The therapist that came from Charlin went above and beyond the process, helped me by what medical term is manual manipulation or tissue massage, getting blood flow moving through, able to help the pain go away by getting the muscles to release. What muscle relaxers do, pharmacologically speaking, but I didn't want to have any more pharmacy going on. I wanted to get off of that stuff. So the therapist used deep tissue, and I talked with Dr. Wright about it as well, and he advocated continuing to move up closer and closer and closer to the surgical site. And look, just like when you go get a pretty deep tissue massage, it's going to be uncomfortable. But the faster you can get all of this released and moving back through, blood moving back through that area, the better. And he just would say, let me know when it's too much and we'll stop. And I wanted to get through that, so I let him honk on things pretty hard, but it was good. And Dr. Wright really liked that process of pushing into, not on the surgical site, but going up So it was down by the knee, and as time went on, over a couple of weeks, we got closer and closer to the surgical site, and I think that was a key to getting off the medication as well. Chris Goff was my PT guy that came and did all that work with me. Brendan was here as well. Brendan was more on the stage 1, stage 2 exercising. Chris was working with me on the manual massage portion of things, instilling the importance of continuing to do the exercises that Brendan showed me. You'll get 2 pieces of paper from Charlin, one stage 1, one stage 2. And so Chris helped me transition into the phase 2 portion of things. It was key to getting off the meds and getting out of bed and moving. So I'm going to start talking about your best friend post-surgery as this device. It is a small cooler that has a pump inside the lid that circulates water through this pipe, through this hose, to a pad that is wrapped around your leg and inside the brace. And I'll talk about how to attach it to the inside of the brace in a moment. Dr. Wright, who performed my hip replacement surgery, recommended that I ice for 1 hour on, 1 hour off. So this device does not have an on-off switch, so I plugged it into a power strip that has an on-off switch. Made it very easy for me while in bed. When my alarm would go off every hour, I'd turn it on and I'd turn it off. The best advice that I was given is to purchase a case of 8-ounce water bottles. We call them stubbies. This device will hold 4 of those very well. And this is the internal pump to the lid. And that fits down inside. This, of course, is filled with water. The pump circulates the cold water through this pad and back into the cooler to be chilled off again before it recycles through. So I kept an ice chest of these next to the bed as well. These last quite some time. And the great thing is that your ice machine in your house is not going to make ice fast enough to function properly with this. If you go and spend $3 at the grocery store on stubbies, you have 24 in your refrigerator, in your freezer, and you're able to recycle those. Every once in a while, one of the lids comes off, you just chuck it in the garbage, But if the lid stays in place, just continue to recycle them and use them, and that will help you follow the directions of your doctor. And again, my surgeon's advice, Dr. Adam Wright's advice, was to ice an hour on, hour off. The other issue is it's very important to have some material between your skin and the pad, because it does get quite cold, and you do risk, if you were to fall asleep and have this thing running for a while, there is a nominal but nonetheless real concern over frostbite. So you want to make sure to have a good layer of material. I had flannel pajamas on, and that was a great layer to have in between the pad and my skin. The pad itself attaches to the inside of the brace that you'll get, whether you're a hip replacement candidate or a knee replacement candidate. And so the pad itself has some Velcro attachments on it. And those affix themselves, put the right way, to the material inside your brace, and it'll stay put. Just make sure that you're not pinching off the pad too much and preventing the water to recycle through as best as you can. The other thing that I want to point out is the attachment point between the pad and the device. And this attachment point is operated by clips. Putting it on and off can be a little bit of a challenge, but the point is that it will leak when you take it apart and leak when you're trying to put it together. And the attachment point is basically going to be over your crotch. So I recommend putting a towel down when you're connecting and disconnecting the device. And that way you don't get wet, and it's a very cold wet, I must say. Okay. These are leg compression devices. They're electronic. They do have a battery inside, and you'll charge that, but it can also operate with the power cord in, so it can operate through the night for you. You wear them on both legs. It's basically a Velcro attachment device that wraps completely around your calf. Once you get it around your calf and adjusted, and it doesn't matter how it's situated, you'll roll the device around your legs and attach and turn it on, and it pumps air. And it pumps air in a very strange way, and its purpose is to move blood from your lower extremities, so from below your knee towards your heart. The concern after surgery is blood clotting, and blood clot can be quite dangerous. You could lose a limb, you could lose your life if a blood clot forms, and you're not doing this correctly. You have to do this every night, all day, off and on. You'll get instructions how frequently to do it, and they want you to wear these pretty much all night long, and they make a little bit of noise, and they're inconvenient. It's bizarre the way they squeeze on your leg a little bit. It doesn't hurt, it's just a different feeling. But it's quite important, along with taking a baby aspirin in the morning and a baby aspirin in the evening time. Again, you'll want to do what your doctor tells you to do, but that's what I did. So no blood thinner injections, just baby aspirin for that, along with using this device. And just like the icing, you must practice this religiously. And your physical therapist and nurse will also watch the way you're laying in bed. You want to make sure that you're not putting pillows underneath your knees. That can cut off blood flow a little bit, and can also prompt a blood clot. So make sure that whatever the nurse tells you to do, your doctor tells you to do, your physical therapist tells you to do, follow those instructions. Along with icing, this is of paramount importance. You have to use it.
Walk us through the importance of the biology of, using a walker in a bathroom, and just kind of walk us through that process.
Sure. Well, we're all human beings, so with input, food and water and other liquids, we have output.
Yeah.
So it's very important to purchase and practice before surgery a seat raiser. So it raises the toilet seat for you so that you don't have to bend as far when you're sitting on the toilet. And it's also much easier, as we all know, getting out of a Ferrari versus a big old Lincoln or Cadillac. It's a little easier to get out of something that's higher. PT, surgeon advice, don't bend the leg past 45 degrees. It's hard to not do that if you don't have a seat raiser. And so you'll want to have the walker in front of you when you're using the bathroom. And it's very important that you are stable getting up and on the device and getting off of the toilet as well. The medication that you're on, the painkillers, they cause pretty severe constipation, and so there's going to be a while before you're able to move your bowels again. But once that happens, you're going to be on the toilet a lot, and it's important to have the seat raiser. I found it to be it just was so much easier getting on and off the toilet, being raised another 6-8 inches off the standard toilet height. So I want to explain the biology portion of things again, getting on and off the toilet seat. You don't want to bend your leg past 45 degrees. So getting on and off the toilet without doing that, it's a little bit of a dance. I'm going to show you how to do it. So again, toilet riser's on there. You can pull your walker, and it's large enough widthwise to come around you as you're sitting on the toilet, and get as close as you can. And this was my surgical leg, my left leg. So I'm going to sit down very slowly and show you how I do that. See how my leg is straight out and I'm not exceeding 45 degrees. And this is very stable, and you're able to sit down and do your business. And when you're ready to get up, it's basically a reverse of that. So what you want to do is keep that leg extended. Make sure that the walker is close to you and it's not too far out, trying to get up that way, but here and underneath you, and you put your weight on it. You stand up using your good leg and push yourself up with your arms and the good leg, keeping the angle of your leg at 45 degrees or less. If you sit down, if you don't have a toilet riser, or you bend this too far, your leg will tell you. It's going to bark at you, and it's very painful. The importance of keeping the grips of the walker underneath your shoulders is of paramount importance as well. Don't push the grips out too far ahead of you. Always keep them under your shoulders and walk upright, and weight the grips with your hands, and walk on your good leg, the non-surgical leg. Keep as much weight off of the other leg as possible. The brace that your doctor will give you to wear following surgery is made of metal. It is set to limit your flexing pursuant to an adjustment that the person that fits you with your brace will give you. It's important to adjust the first strap in a height on your body that flexes at the same angle in the same place as your hip will flex. Let's get the top strap adjusted first. Then you can very easily, with both hands, get the lower strap adjusted around your thigh. Once everything is put in the proper place, go ahead and set them a little tighter so they stay in place for you.
We hope this information was a blessing to you. Feel free to visit us at www.charlin.org. Zack was also gracious enough to leave his information for you if you have any questions along your patient journey. A special thanks to Dr. Wright at Plano Orthopedic Sports Medicine Center for doing such a great job with our patients. God bless, and see you next time.